year, thousands of Americans are severely injured in auto, workplace, and other catastrophic accidents. The catastrophic injury is life-changing to the injured person and his entire family. Lives are halted while he faces overwhelming challenges. Once medically stable, he begins a daily routine of 4 to 6 hours of therapy in the hospital's acute rehabilitation facility. With progress, he will return home and begin to rebuild his life. That day is eagerly anticipated by the entire family, but it can be a challenging transition. Important decisions must be made, such as selecting the right home care and rehabilitation service. The medical team's catastrophic care solutions helps maximize each patient's rehabilitative potential in the comfort of their home. We specialize in life-changing injuries. To ensure continuity of care and ease the transition, our services begin well in advance of the patient's return home. Meeting with the patient and family, our nurse case manager first provides a free consultation and assessment. Our family-inclusive approach lays the groundwork for the best possible outcomes. After the assessment, our nurse case manager develops a care plan designed for the patient's specific and unique needs. This process begins her ongoing role as a resource for help and support for the entire family. The nurse case manager then arranges interviews with our nurses and certified nursing assistants. Patients and families are encouraged to participate fully, since these caregivers will play a central role in their lives. We aim to find the best possible fit between the patient's needs and our caregivers' skills and expertise. With input from the patient and family, the nurse case manager assembles a team of experienced medical professionals who are skilled at handling severe trauma injuries. Due to the medical complexity of catastrophic injuries, we offer a multidisciplinary team approach, which includes regular team conferences to measure outcomes and ensure communication. Our nurses have experience in specialty areas related to life-changing injuries. Support services are provided by certified nursing assistants who can provide one of 3 levels of care, from attendant care to high-tech care. We offer a full range of therapies, including physical and occupational therapy, as well as speech pathology. Since the grieving process following a catastrophic injury can last for years, we offer the services of a social worker or psychiatric nurse through our Journey Behavioral Health Program. Members of our team are credentialed through the Brain Injury Association of America. We are one of the few agencies to offer both a wound care management program and a behavioral health program. Our caregivers are trained to work with a behavioral analyst to help modify negative behaviors like combativeness. And when family caregivers need a break, we offer short-term respite care. We understand that patients can be apprehensive about returning home, since they will be working with a new team. To ease patients' potential concerns and to ensure a smooth transition, our caregivers work with the patient's hospital team. They familiarize themselves with the exact procedures the patient has been following so that care can continue uninterrupted. To avoid regression during the transition home, our nurse case manager attends the patient's discharge planning meeting. She incorporates any additional doctor's instructions into the care plan, answers last-minute questions, and ensures that the right equipment is in place. She also assists the independent nurse case manager in ensuring a smooth transition. Once home, our team works closely with the patient and his family. His nurse will provide everything from round-the-clock nursing to occasional visits for wound care. Personal care services are offered for help with activities such as bathing and dressing, and our therapists each focus on a different aspect of the patient's rehabilitation. The physical therapist can help with balance and strength training. The occupational therapist helps with life skills, including daily routine tasks. If needed, we can help patients obtain home modifications and adaptive aids such as ramps and grab bars. We understand the challenges facing the family during the transition home. Our staff is always available to provide information and comfort as they work together to integrate the patient back into the family setting. The nurse case manager makes regular visits, exceeding Medicare and CHAP accreditation requirements for supervision. To ensure quality of care, we conduct monthly patient satisfaction surveys, which are shared with the patient's insurance company and independent nurse case manager. We also provide a monthly summary showing any changes in care, doctor's visits, and medication profile. The patient's physician is regularly updated on his status and outcomes. Catastrophic Care Solutions strives to provide excellent care that maximizes each patient's rehabilitative potential. It is possible to lead a full and productive life after a catastrophic injury. With the medical team's help, patients can achieve a more active life to the fullest extent possible.
When considering the options, be sure to choose a home care agency that will provide the full range of support needed to maximize the patient's rehabilitative potential.
We have the experience, skills, and commitment to provide that support.
We pledge to provide outstanding customer service, to resolve issues promptly, and to treat our patients with dignity and respect.
Physicians, case managers, discharge planners, and social workers can count on our responsiveness
And effective communication of the patient's status and outcomes.
We are confident that our commitment to clinical excellence will result in the highest quality of care to our patients.
We are the medical team's Catastrophic Care Solutions.
When home is the best place to get better, bring home the medical team.